Hi, my name is Diana,
And I'm Jasmine.
and our Minisentation is on how the amount of sleep you get affects the human body.
So, what happens when you don't get enough sleep? Your immune system weakens, you can have difficulty focusing, you can see changes in your mental health, your appetite can change, you can have worse acne, and your balance can become more poor, and you can experience changes in your mood.
In your immune system while you sleep, there is a certain cytokine that is released, and when there's infection or inflammation in the immune system, these cytokines increase and combat this illness. And if your body is deprived of sleep, it may actually decrease the production of these cytokines and infection fighting antibodies. It is a well known fact that the lack of sleep causes distractibility, loss of concentration, and confusion. And the reason for this is because the mind is not getting enough rest, and also because the lack of sleep can cause neurons in one's brain to malfunction. If these neurons cannot function properly, it affects the person's behavior and has an impact on their performance, in this case, being their attention and focusing.
Okay, so sleep and mental health are actually very closely connected. Sleep problems are more commonly seen in patients that suffer from disorders such as depression, anxiety, bipolar disorder, and ADHD. When you have a good night's sleep, it can help stimulate your mental or emotional resilience. Chronic sleep deprivation can lead to negative thinking and thoughts and emotional vulnerability. Okay, so next is appetite. And when you eat correctly, but you are not receiving the proper amount of sleep needed, your health does not function properly. But when the opposite occurs and you have enough sleep, but you are not eating properly, your body can malfunction. So the hormone that is responsible for controlling hunger and appetite is ghrelin, and it stimulates appetite, making you hungry and crave food. And the other hormone is leptin, which makes you feel full and satiated and suppresses appetite. People with a normal sleep schedule have them balanced and are working to regulate normal feelings in hunger and appetite. But when you lack sleep, this alters the ghrelin and leptin balance, and this can lead to a change in your appetite. Also, short and disturbed sleep increases appetite for high calorie foods.
Acne is another effect of lack of sleep, and it is caused by an outbreak of a stress hormone called cortisol. Cortisol is a hormone that causes inflammation and flare ups, otherwise known as acne. And yeah,
So
lots
lack
of
of sleep can also lead to poor balance. So it affects balance and coordination, and it can make you more prone to falling and causing other physical accidents. Um, Lack of sleep actually has the same effect on your balance as alcohol intoxication does. So if you're lacking sleep, you may stumble around and have poor balance and coordination. So it can also affect your mood changes and make you moody, emotional, and very quick-tempered. So these mood changes can lead and escalate to anxiety or even depression. You experience increases in your negative moods and decreases in your positive moods. These mood changes can hurt your work performance and everyday life.
So, how much sleep do you need? Based off the chart below, as you can see, ranging from an infant to an adult, the amount of hours you need of sleep decreases as you grow older.
Controlled versus diagnosed depressive adolescents. So, when a group of controlled adolescents and a group of diagnosed depressive adolescents were tested, the depressive diagnosed group um, had a total average of 3,325 minutes of sleep per week, and the controlled group had never experienced anxiety or depression. Reported a total average of 3,597 minutes of sleep per week. So those who experienced depression reported both poorer quality and quantity of sleep. The teens who didn't report with anxiety or depression experienced much better sleep. Therefore, the depressive group got an average of 272 minutes or three and a half hours less sleep a week compared to the controlled group.
So to summarize, everyone needs to get a good amount of sleep to prevent some of these side effects from occurring. And a reminder for us teenagers, we should be getting around 8 to 10 hours of sleep to feel prepared, focused, and healthy for the day. And here are our citations.